One day, a patient visited my clinic due to abdominal pain. After a series of investigations, one large liver tumor with a size of nearly 20 centimeters was found. Hello everyone, I'm Dr. Liu Yuzhi. Welcome Dr. Ming-Lun to the Care Online. Hello everyone, I'm Dr. Ming-Lun. What are the screening tools for HBV? Generally, we will assess the HBV expression in patients' blood, like hepatitis B surface antigen, which is a serological hallmark of HBV infection. If one patient is positive of hepatitis B surface antigen, we call him an HBV carrier. We will follow up the patient's hepatitis B E antigen, hepatitis B E antibody, and the viral load. These tests help us know the status of HBV. In addition, we need to know if patient's liver has been injured. So, we do the liver biochemical and function test. The liver biochemical include GOT and GPT, the most common markers of liver injury. For patients with severe liver disease, we measure the levels of serum albumin and bilirubin, as well as prothrombin time. These data reflect the liver function and help us to know if patients are undergoing liver injury caused by chronic hepatitis B. That's the information about blood test. Apart from blood test, we conduct other investigations, like abdominal ultrasound. It helps us know if patients have liver fibrosis and cirrhosis caused by chronic hepatitis B. By using an abdominal ultrasound, we can detect liver tumors or liver cancer. For patients with chronic HBV infection, the investigations I mentioned are essential. When should patients receive liver biopsy? Sometimes liver biopsy is recommended for patients with HBV infection. When should we recommend the patient to receive liver biopsy? Some HBV infected patients have quite high viral load, but relatively normal concentrations of GOT and GPT. Even though abdominal ultrasound is useful to assess the degree of liver fibrosis, its usefulness is limited when assessing liver inflammation. Thus, for patients who are expected to have severe liver inflammation but have normal levels of liver enzymes, we will recommend them to receive liver biopsy. Liver biopsy provides us with more accurate information about liver inflammation. We can know the degree of liver inflammation and liver fibrosis. For patients with normal levels of liver enzymes, if the result of liver biopsy reveal moderate to severe hepatitis or advanced fibrosis, they would be recommended to receive antiviral treatment. Because liver biopsy is an invasive test, risk like bleeding exists. Other non-invasive investigations are currently used to detect liver fibrosis, like the liver FibroScan. It can tell us the severity of liver fibrosis, the main basis of initiating HBV treatment. What are the surveillance recommendations? The first step is to identify the status of HBV. There are two status. One is inactive HBV carriers. These patients have normal concentrations of liver enzymes and low viral load. They do not have liver inflammation and fibrosis. Do these patients need regular follow-up? The answer is yes. Why should these patients receive regular follow-up? Even if these patients do not have liver inflammation, liver fibrosis, and the need to take antiviral treatment, they still have risk of liver cancer. We recommend these patients to receive follow-up every 6 months. The follow-up tests include liver enzymes, alpha-fetoprotein (AFP), and abdominal ultrasound, assessing the risk of liver cancer. As for another status of patients, the patients with active chronic hepatitis B. If the patients are under antiviral treatment, we would recommend them to receive blood tests, such as liver enzymes and viral load every 3 months, to evaluate the efficacy of treatment. For surveillance of liver cancer, we recommend patients to have an ultrasound examination every 6 months. For patients with severe liver fibrosis and cirrhosis, their check-in time needs to be shorter. They need to receive abdominal ultrasound every 3 months. In this way, we can detect liver cancer in early stage. This case is a young, less than 40-year-old patient with chronic HBV infection. One day, he visited my clinic due to abdominal pain. After a series of investigations, one large liver tumor with a size of nearly 20 centimeters was found. He was diagnosed with liver cancer. He was found to be a HBV carrier at the same time. I asked him, "Did you know you have hepatitis B virus infection?" He answered, yes. He knew that he had got chronic HBV infection since he was a child. From past medical visits, the doctors told him that he was just a healthy carrier because his liver enzymes were within normal range. It means that there was no need to receive follow-up. Therefore, he did not receive any follow-up for hepatitis B afterwards. As long as you are a chronic HBV carrier, regardless of the current levels of liver enzymes, viral load, and degree of liver fibrosis, you have risk of liver cancer. Hepatitis B virus itself has potential to induce liver cancer. Not only abnormal liver enzymes and high viral load may induce liver cancer. For all HBV carriers, regular follow-up and surveillance for liver cancer are recommended. Thank you, Dr. Ming-Lun, for coming to the Care Online. See you next time. Bye.